Morning friends. As per the International Classification of Disease, Mental and Behavior Disorder, F40 deals with agoraphobia. Agoraphobia means fear or avoidance, either fear or avoidance of at least two of the following. Number one, crowds, public place, traveling alone or traveling away from the home. So in agoraphobia, the criteria number one is there would be a marked consistently manifestation of fear or avoidance of at least two situations, and the situations are entering into a crowd or to a public place, or traveling alone or traveling away from the home. Criteria B is whenever the person concerned had to face all this situation, there would be anxiety, at least two manifestation of anxiety, either in form of autonomic arousal symptoms like palpitation, sweating, trembling, sacking of the body, dry mouth, dehydration situation, or symptom concerned with the chest and abdomen like difficulties of breathing, feeling of choking, chest pain, discomfort, nausea, abdominal distress, churning of the stomach, or the symptoms concerned with the brain and the mind. For example, feeling dizziness, unsteady, faint, lightheaded, feeling that the objects are unreal, derealization feeling, that oneself is distant, not really here, or depersonalization like feeling, fear of losing control, going crazy, passing out, fear of dying. These are the symptoms concerned with the brain and mind. And few general symptoms also like hot flushes, cold chill, numbness, tingling situation, etc. Criteria C for the agoraphobia is it's creating a significant emotional distress with the person concerned due to worriness, preoccupied with the anxiety and avoidance to facing that situation, and recognizing that these are excessive, unreasonable. Criteria D is symptoms dominant only in certain situation, restricted situation, predominant in the fearful situation. Probably when thinking about those situations like facing a crowd or facing a public place, traveling alone, thinking about traveling away from the home, these are the thinking or the provoking thinking which provoke the arousal of anxiety like situation when the person think about facing that situation. So this is the criteria D, and the criteria E is you have to exclude certain other important common mental disorders. Those are out of intoxication or hallucination or delusion, or some other symptoms you have to exclude, like it should not be because of certain affective disorder, mood and affective disorder, not because of certain schizophrenic symptoms, not because of substance use disorder, not because of certain organic disorder, obsession, belief, religious belief, cultural belief, or not because of certain obsession or compulsion. It should not be because of certain medical disorder, surgical or critical illness. This must be excluded. These are the exclusion criteria. So criteria is the exclusion criteria. So again we can say agoraphobia means intense feeling of fear or intense tendency, urge to avoid to face the situation, and situations must be out of this four, any at least two: crowded place, public place, traveling alone or traveling away from the home. Similarly, criteria B is provocation of anxiety symptoms, criteria C is emotional distress, criteria D is only happen in the restricted situation, and criteria E is certain exclusion of other situation that can be similar to this kind. So it must be excluded by proper physical examination. So this is agoraphobia. So what is the treatment for this? Yes, of course, you have to meet your nearby doctor, preferably psychiatrist, then go for the instruction given by him and follow the treatment restrictively under observation and close monitoring. You need a family support, share the thought that arising in the mind, and other psychological therapy. Beside that, you can get help by practicing certain discipline in your day-to-day life, lifestyle modification, and changing your habit of sleep, eating, and your working, overworking activities. Thank you.